we have mechanical lifts. What is it? Grander lift?
The back of her hoodie says McLift. I thought it was funny.
We have several names. You might hear it called sling, mechanical lift, Hoyer lift. Is it grander lift? Grander? There's another name. Some of them, their whole body's in a sling. Sometimes it's from just the shoulder to the knee. We should at least have them covered from shoulder to knee, okay? That's a better base of support for our patients. This is what this one is. It's going to go from her shoulder to her knee. Some of them will stand completely up. This one does not, okay? We use this to weigh patients, to transfer them to a chair, transfer them to the shower room, okay? Most of our patients that we are using a lift on cannot move themselves, okay? Most of them are elderly, or maybe they have a traumatic brain injury, something that has caused them to be immobile and not be able to transport themselves, okay? So they are fearful that we're lifting them away from the safety of the bed, okay? It's kind of like a baby. You know how a baby does this? Our patients are fearful. So number one, we want to reassure our patients that we are in control of our machinery, that we know what we're doing, that we are going to do everything in our power to prevent them from having an injury, okay? You always have a second nurse to assist you, okay? So that if your patient does begin to fall or this teeters over, that because machinery can fail, right? Machinery fails, so do we, but machinery, you can count on it. So always have a second nurse. If she began to fall, Steven, what body part are you going to grab? What do we need to protect the most on her body? Her head, that's right. Hip fractures are bad, guys, but head fractures are way worse, okay? So we're always going to protect her head. So I won't even have to tell him that. It's going to be instinct. He's going to grab her head, okay? So we're going to bring our Hoyer lift over our patient. Well, before that, let me back up. I would put this underneath my patient. So I would, if they were immobile, I've got to have my patient roll over to the side. Okay, so we would assist her. I would push. He's going to pull. Okay, put this side rail down. This is a really old one. Where do y'all think this hole goes?
Under her foot.
That's correct. Okay. So I'm going to place this under her, making sure I'm going from shoulder to knee. Okay. Got this really under her. Before I bring her back over, I'm putting my side rail back up for her safety. Miss Holmes, now I need you to roll over this big bump for me and continue rolling over. Grab this rail. Come over, and we're going to straighten this out underneath her. Okay, now you can lie back. And I would like for you to cross your arms for me so that they'll be safe and not get injured. And cross your legs for me. Okay, so we're going to make sure this is really good and centered under our patient. I really need to move you to the left. So we would either need, if she couldn't do this herself, to the right of me. If she couldn't do this herself, we would readjust it. We would not pull it underneath her because we don't want to shear her skin, okay? All right, now I'm going to move my rail out of the way. I'm going to first make sure that the brake is on this bed. And I already have done that. It's down here. No, it keeps going up. The brake is on the bed, okay? Because I don't want this bed moving. Now I'm going to position this. There, that's what keeps hitting the brake. Okay. I'm going to position this underneath her. Steven, could you grab those so they do not injure the patient's skin? We don't want them to bruise the patient, tear their skin. Okay, so it's completely under there. All of your machinery should tell you on the machinery somewhere all the instructions on how to use it. They're on this side, okay, and it starts with the first thing, okay, and goes down to the capacity, the weight capacity. This machine says the weight capacity is 400 pounds, okay, so we know we're safe for her. If she weighed 400 pounds, should we use this? If she weighed 399, should we use this? Probably not. Probably not, Blake, okay? So, we need something better, because then we're risking the chance that this is going to tump over, okay? Excuse me, I'm just had lunch. Okay. See how I've got these hooked together? It's so they don't swing around and injure our patient. So we want to have control of those. Now I'm going to get this as close to my patient as I can, and it's hitting something. See how close I am to the bed? Okay, now I'm going to lock this in place, okay? Put my brake on. I've got my bed locked, my brake is on this. And now I'm going to lower the hydraulics on this. This is not electric. If it was electric, I'd push a button. This is hydraulic. There is a lever here that tells me that if I move it to the left, it lowers this, and if I move it to the right, it raises it, okay? So I'm going to slowly do that. I don't want it to slam into the patient. So I'm going to do that slowly. Do you see that? Okay. And now I'm going to turn that back off. And I'm going to put my hooks on. Now, my hooks will go away from the patient so that I do not injure her skin when we're lifting her. So it hooks completely through. See, that is completely through. I'm going to come over here and hook this one. You might have to bunch it up a little. It'll straighten out as we lift her.
In on a certain side?
Yes, it does. And usually it has instructions on the side, okay? Okay, now I'm going to make sure again before I'm lifting her, my brake is on my bed and my brake is on here. Then I'm going to start my hydraulics or my electric button to lift her. I'm going to reassure my patient again. Okay? Ms. Holmes, I know you're scared. I know you're afraid we're going to drop you, but I promise we're right here. We're going to do this very slowly and you're going to be safe, okay? She said okay. Okay, so we're going to lift her. So this takes a minute and it feels weird.
She said, oh my gosh, this is scary.
It is. Okay, so, like I said, if your sling does not completely cover your body parts of your patient, we need my second nurse, and you don't have to, I'm just telling you right now. My second nurse is either going to support her head or support her limbs, okay? If you have a 6'7" guy, yeah, we don't want to cause any neck injuries. So our second person is going to support the limbs, okay? Okay, now I have her, I'm not going to move her, I don't trust this completely, so I'm not going to move her around this room, okay? Y'all done? Okay, before I move her away from the bed, I'm going to widen the stance of this lift, okay? Just like you have better balance if you stand with your feet apart. So does this machine, okay? So my brake is on. I'm going to widen it. Let me go this way. Ooh, here she goes. Slowly. Okay. Now, before he's going to support her head, if I was moving, I'm going to reassure her again. Okay, here we go. We're going to move very slowly. It's going to be okay. We're going to take you to the shower room, okay? I'm making sure her limbs and her head are not touching or bumping into anything. I've got it widened. The brake is off. And I'm going to slowly move her to where I need to go, okay? Okay, we gave her a great shower and we weighed her. Now we're coming back. Slowly. Position your patient. Remember, they're immobile. Position your patient where you want them to be in the bed while you still have them on the lift, okay? So you don't have to strain your back trying to move them around. So let's get her in a good position. Okay. Again, I'm going to make sure my bed is locked. It is still locked. I'm going to lock this machine, okay? I'm going to take this back to its original place. Now I'm going to slowly lower her back. So don't turn your button too fast so they crash to the bed, okay? Lower her.
But you have to have control of this side
Slowly.
too.
Okay.
Okay.
Have you got her head?
Because
I'm just telling you this out loud.
you don't-
We're protecting her head as we lower.
you know,
Okay.
you want to maintain.
Okay. Ms. Holmes, you're safely back in the bed. Now give us a minute to get this out from underneath you. When we take these off, we're going to hook them back together so we lessen the chance that we're going to injure her.
My fingers are touching right here.
I'm going to raise this back up. Wish I had an electric button.
Last semester, Amber dropped me on the bed. She let me slam into the bed.
Who let her do
It was Miss Knight doing it, and she was having us back.
Way to call me out.
Yeah. Okay.
This is why we don't let Amber touch
See how
things.
he's got control of that? He's making sure the patient is not going to get injured. And now I'm ready. I'll take the brake off. And I'm going to come away from the bed. Now, are we finished? No. What have we left?
The bed rail.
What?
We got the
Oh, that's right. You're right.
You got the thing under.
Was that just unsafe? Did I leave my patient vulnerable? Yes, I did. Okay, now we've got to remove this. Even if we're going to lift her again in an hour, we don't leave this underneath them. It does not breathe, okay? So they can have breakdown that fast. We can start breakdown in an hour. So never leave these underneath them, okay? They have metal strips on them too. Ms. Holmes, I'm going to have you turn towards this rail so I can get this out from underneath you, okay? roll this up. Before she comes back over, I'm gonna put my bed rail back up. Okay, I need you to come way over the hump and keep coming. Get out. Okay? You're gonna remove that. Now we're gonna go put her back in a comfortable position. Okay? Make sure our side rails are up and the bed's in the lowest position. Okay? Now, let's review. Because you will not check off on this skill, but you may see it on the test question. So, what's our patient's main concern? What are they feeling when we're lifting them?
Fear.
Yes, they're fearful, right, that they're going to fall. So we need to reassure our patients. I don't know why that's like that. Okay, so when we put our machinery over the patient, what do we need to cover at least? What area? Shoulder to knee, absolutely. Oh, so we can have some stability. What do we need to make sure about this bed? It's locked. Bed is locked. When we position this under our patient, we get as close to the bed as we can, and then we do what to this machine? Lock this machine, okay? We're going to make sure that we do not harm our patient's skin with these metal, what am I trying to say, hooks. Hook them completely into your patient, making sure, check your brake again before you start lifting your patient. Start the hydraulics to lift her. Have a second person always. Do not lift anyone anywhere without a second person. Have them supporting the limb that needs support, head or feet, okay? From preventing them from injuring themselves as we travel. Okay. After we've lifted the patient, we're going to reassure them again that where we're going, maybe how long it'll take us to get there, that we've got 2 people to make sure that they're not going to get injured and that they're safe. We're going to go slowly, okay? We're going to widen this machine's base before we move, okay? When we come back, the first thing we do is get them in a good position, slowly lower the lift. But before we start lowering them, what do we need to make sure about this machine? Lock it. Don't forget, your wheelchair and this, treat them all the same. Machinery fails. We can't trust it, okay? And then just make sure that you remove this out from underneath him, okay? Y'all think y'all got that? Any questions about that? Safety is first, okay? So make sure you've got your brakes on. And you've got a second person. That's the kind of test questions you would see from that, okay? So it may be called, I'm going to remind you, it's either called a sling, a Hoyer lift, a mechanical lift. I think that's the only thing I've seen on tests, is those three things, okay? They all mean the same thing, okay? Okay, that's it.